welcome back. So we will discuss the topic febrile convulsions in this video. We are having a scenario that there is a 3-year-old child with history of fever and cough for 2 days and has tonic-clonic seizures for 13 minutes. He has had 2 such episodes of fever with seizures in past, and on examination, child is conscious with temperature of 102 degree Fahrenheit and congested throat with no signs of meningeal irritation. Another scenario is that there is a 2-year-old child unwell since morning and he has high grade fever and temperature. Mother has noticed a brief generalized seizures which settled in 5 minutes. Physical examination shows normal activity, child with normal anterior fontanelle, and he has congested throat. He is diagnosed as having febrile fits. Okay, so in febrile fits or febrile convulsion, we are having the history of high grade fever and cough, and there is the congested throat signs. So we are having a definition of febrile convulsions as these are defined as seizures associated with fever in absence of detectable CNS infections. The causes are rapid increase in temperature and disturbance of cerebral activity, and the clinical features are fever, respiratory infection, and seizures. The investigation options that are done for febrile convulsions are blood count, lumbar puncture if required, blood sugar, calcium, phosphorus, and urea and electrolyte, and EEG is done, which is indicated if febrile seizures are complicated. Now the treatment options. For first of all, the fever is measured and then appropriate antibiotics are given. For seizures, diazepam 0.2 mg per kg slowly diluted in intravenous is given. Phenobarbitone 5 mg per kg is given. Paraldehyde 0.15 ml per kg is given. And to lower the temperature, antipyretic, that is paracetamol, is given. For prophylactic, anticonvulsants are given. These are diazepam, phenobarbitone, sodium valproate, phenytoin, and carbamazepine. So this was all about the febrile convulsions, that we are having the features of high grade fever and congested throat. And there are seizures present, and episodes of seizures are present. Here there is high grade fever, brief generalized seizures, and has congested throat. Okay, so this was all about the febrile convulsions. We have discussed the features which are increased fever and congested throat and episodes of seizures, and then we have discussed the definition of febrile convulsions, that what is it, and then we have discussed the causes of the febrile convulsions, and then the clinical features, and then the investigations, and then at the end we have discussed the treatment options and the specific management of the febrile convulsion. That is, for fever, treatment is provided. For seizures, to lower the temperature, and prophylactic treatment is provided. Now coming towards the next topic, that is epilepsy. So for epilepsy, we are having a scenario that there is a 5-year-old girl who has history of generalized tonic-clonic fits for past 2 months, and fits come once or twice a week and last for 10 minutes, and there is frothing and incontinence of stools or urine during fits. There is no history of fever, fall, or drug intake. The girls look normal physically and mentally with no neurological deficit or any abnormal finding or systemic examination. So these are the features of the epilepsy, that is having generalized tonic-clonic fits, and fits come once or twice a week and it lasts for 10 minutes, and there is frothing and incontinence of stools or urine. So these are the features of epilepsy. Now we are having the definition of epilepsy as seizure is defined as paroxysmal involuntary disturbance of the brain function that may be manifested as an impairment or loss of consciousness, abnormal motor activity, behavioral abnormalities, and sensory disturbance. The causes of epilepsy are vascular causes, for example, stroke and arteriovenous malformation, infection, for example, meningitis and encephalitis and abscess, trauma, autoimmune and metabolic causes, that is hyponatremia, hypocalcemia, and hypoxia, idiopathic causes, neoplasm, genetic and development. Okay, now the classification of epilepsy. We are having generalized seizures, partial seizures, unclassified seizures, and epileptic syndrome. So, in the generalized seizure, we are having tonic-clonic seizures, myoclonic seizures, absence seizures, which are typical and atypical, atonic seizures, tonic seizures, and clonic seizures. In partial seizures, we are having simple partial seizures and complex partial seizure. Simple partial seizures, we are having motor signs, special sensory signs, autonomic signs, and psychic signs. In complex partial seizures, we are having impaired conscious onset. The unclassified seizures are neonatal seizures, and the epileptic syndrome is benign focal epilepsy, juvenile myoclonic epilepsy, West syndrome, and Lennox syndrome. Okay, so this is the classification of seizures. It is classified into four main classes, that is generalized, partial, unclassified, and epileptic. And these are the further types of the following given. Now, investigations that are done for epilepsy is that first of all, the detailed history is taken and physical examination is done. Then on investigation, EEG is done, there is electroencephalogram to check for brain activity. CT scan brain is done, CBC is done, blood culture is done, and lumbar puncture if the meningitis is suspected. The management options for epilepsy are that anticonvulsant therapy is given, education about the disease is given, and adrenocorticotropic hormone and corticosteroids in infantile spasm and in Lennox-Gastaut syndrome is done, and ketogenic or medium chain triglyceride diet is given, and surgery for poorly controlled seizures is done. The drugs that are used in epilepsy are phenobarbital, phenytoin, valproic acid, carbamazepine, lamotrigine, and vigabatrin. These are the specific drugs that are used for the epilepsy. So we have discussed the case of epilepsy, that there is a patient who is having the history of generalized tonic-clonic fits, and fits come once or twice a week, and there is frothing and incontinence of stools or urine also. So we have discussed the definition, that seizures is defined as paroxysmal involuntary disturbance of the brain function that may be manifested as an impairment or loss of the consciousness, abnormal motor activity, behavioral abnormalities, and sensory disturbances. The causes are vascular, for example, stroke, arteriovenous malformation, and infection, for example, meningitis, encephalitis, and abscess. And trauma is the cause, autoimmune and metabolic, that is hyponatremia, hypocalcemia, and hypoxia, idiopathic neoplasm, and genetic development. In the classification, we are having generalized seizures and partial seizures, unclassified seizures, and epileptic syndrome. And in investigations, we will do the EEG, the CT scan brain, the CBC, the blood culture, and the lumbar puncture of if meningitis is suspected. The management options are anticonvulsant therapy, education about the disease, and the ketogenic or medium chain, and the surgery. And the specific drugs that are used for epilepsy are phenobarbital, phenytoin, valproate, and carbamazepine, lamotrigine, and vigabatrin. These are the specific drugs that are used for the epilepsy. Now, in the next video, we will discuss viral encephalitis and meningococcal meningitis. We have already discussed the pyogenic, that is meningococcal meningitis. In the next video, we will discuss the Guillain-Barré syndrome and the cerebral malaria. Thanks for watching.